First of all, thank you all for joining us. A big thank you to our panelists, and a big thank you for the over 300 people that registered for this panel. I'm Dr. Alice Stanton. I'm happy to be your moderator for this evening. I'm a PhD scientist and a postdoctoral associate at MIT. And I'm really excited to be joined by these incredible and incredibly experienced physicians here. And we really have a great breadth of backgrounds and experiences with you all. So thanks so much for taking the time. So I'm going to launch a poll to get started. And the point of this is to really get a sense of who is with us. So we had a lot of registrants, but I want to know who are the really passionate ones who logged in early and are here with us now. So if you could take a second, fill out this poll, we'll get a sense of where to focus our energies here tonight. Okay, so again, thank you so much for joining us. If this is your first time joining a STEM XX Chats event, a special welcome to you. All of this is made possible by that. And this organization really began with a desire to empower women in STEM through information, through role models, but not just that. You know, we're really building what is really like an ecosystem of empowerment for women in STEM. We're breaking down barriers between different career stages, different locations, and we're really propelling positive change makers to solve the big challenges of our day. And we do this in various ways. Our small core groups that meet regularly, our team projects, and also our more public events like the one that you're joining us for tonight. So we have many awesome panels planned this fall. This is kind of a preview, if you haven't seen it, of our upcoming panels as well. And we have some fantastic women who will be interviewing over webinar, including the possibility of live Q&A. So top women in STEM, really good people. And so we're really looking forward to chatting with them. The next one will be Kate, who is the founder and CSO of a startup called Cala Health that's using electricity as medicine to treat a number of conditions like essential tremor. So it's kind of related to our medicine talk tonight. So that registration link actually just went live today. So follow that link and reserve your spot while there's still space. And to be among the first to know about future events and find out when links go live, you can subscribe to our mailing list, get the latest on what we're up to, follow us on Instagram and Twitter. All right, so with that out of the way, on to our featured presentation. This is our first panel on medicine. So to really maximize returns, we have our panelists who are, incredible physicians and are actively in medical school. And they have many, many colleagues and friends who opted out of medicine in different points in their career trajectory, as do I. And in fact, I was pre-med all through college. And was really always on the fence as to whether to go that route or not, ultimately decided not to. But I think there's really a lack of resources out there to help inform people's decisions, right? And so there's a big motivation for hosting this panel. A lot of the girls that are in our program are interested in medicine. So it's great that we could kind of do our part one attempt to tackle this tonight. So our panelists are going to shed light on the medical field so that we can get a better sense of this. Our panelists, you have a large sample size of who has stayed in medicine, who has thrived in medicine, who has thrived in other routes, advice that you have for being a doctor, for being in this field, inspiration, maybe looking back what you would advise, all kinds of advice. And so really excited to hear all of that. And I see that we do have our Dr. Jenny Driver. Jenny, thank you so much for joining us. Glad you made it.
Great to be here. Sorry, I was a few minutes late.
No, not at all. We're glad that you made it. And Jenny is trained as both an oncologist and a geriatrician. And feel free to add in or correct me if I get anything wrong here. But I think that you're still interested in the prediction and prevention of age-related cancer and neurodegenerative disease. She's a professor of medicine at Harvard Medical School and an associate physician at Brigham and Women's Hospital. Awesome. Okay. And then Dr. Dorothy Martinez is an attending endocrinologist with special interest in diabetes and thyroid disorders, clinically and as well as research topics. She's a clinical professor of medicine at UCLA with more than 20 years of experience. Dr. Esther Dunn is an emergency medicine physician. She is a doctor of osteopathic medicine, so trained as a DO, which maybe she can talk a bit about as well. She has over 15 years of experience and has specialties in accidents, injury, and trauma. Dr. Shirley Gonzalez is a pediatrics and obesity specialist with over 25 years of experience in the medical field. She graduated from Northwestern University School of Medicine. She is trained in naprotechnology as well and is doing quite a bit of telehealth appointments, so I hear. And she's currently at Boston Children's Hospital. Maggie McCann is an MD PhD student at Creighton University. She received her master's in laboratory animal science and neuroscience from Stanford University and also studied veterinary medicine for a time before starting med school. She has her board soon, and we're really grateful that despite that, she's here with us tonight. So all of our panelists, thank you so much for joining us and taking your time to share your wisdom and experiences. To structure this evening a little bit, we have a basic plan to give a sense of that roadmap. We're gonna start by hearing kind of like a snapshot of their journey in medicine. And then we'll hear more about the particulars of life in medicine, how they manage it, and then we'll end with their advice. All right, and for everyone who's joining us here, please submit your questions through the Q&A function. We'll have that Q&A function being monitored so we can try to integrate things in as we go the best that we can. All right. So, how did you get here? This is really a great chance for each of our panelists to share a little bit about their journey, about their story. And I think in preparation of these questions, I guess I'll preface it saying that college and high school students had input in crafting these questions. And many of them want to know kind of how this developed. Was it like an instant spark? Was it in like one moment that was pivotal? Did it build up over time? How did you know that this was the profession for you? So I'm going to pose this as our first question, and anyone who wants to jump in first, feel free.
Well, I can go if you like. So again, I'm Jenny Driver, and I really had no idea I wanted to go into medicine until a few years before I did. I think it was two things. One was that my mother had cancer a number of times, first when I was in grade school, then in high school. And I think just accompanying her to appointments and seeing the difference it made if she had a doctor who was, empathetic and a good communicator versus not. That definitely was part of it. And then I also got a chance to go to India as a young person and to see leprosy actually up close back in the 1980s. And I ended up studying about it. And I think that was the first time I studied medicine. So those two experiences really helped me to see that I probably wanted a career that would be centered on people, but also would be very practical, in terms of helping them and attending to suffering in particular. That if there would be something I could do to help the suffering in the world, that would, that was what attracted me. So I think that was my very idealistic beginning. And then I loved biology, but I'll be honest with you, I was never good at math or chemistry or physics. I had to struggle with those subjects, but that hasn't kept me from being very happy and productive as a physician. So for all of you out there who are worried that you don't excel at math, it's okay.
I can.
Go ahead. You start. Okay.
Yeah.
All right, I'll go ahead. So I'll just keep this really brief. So my journey to medicine, if you will, is very organic. I actually started off in the veterinary world. I decided I was going to be a veterinarian when I was 10 years old, and I stuck with that plan through the first year of veterinary school. And I really loved it. I actually cried my way through my last final because I thought I might be leaving. But I guess what sort of flipped me to switch to an MD was I did a lot of teaching right before I started veterinary school, and I really, really loved working with people. And I also, my undergrad, I took a slight detour. Even though I knew I wanted to be a vet, I took a detour in undergrad and I studied philosophy and theology because I really enjoyed that. And so sort of the combination of wanting to be more involved in bioethics and also really enjoying working with people pushed me more towards the MD side. So I decided that I probably should switch. So I left veterinary school, and then I was doing my master's while I applied to medical school. And that really gave me a chance to just delve into a lot of research. It was an unusual master's. I was able to pretty much research the entire time because the program accepted my veterinary school credits. So the research was really, really fun. And when I applied to medical school, I applied for the MD PhD a couple of places, but it turned out that I got into Creighton's medical MD PhD program, and I really enjoyed it so far. I would say it gives you really an intellectual outlet that sometimes med school classes, when you're really feeling down, it's kind of nice to have something bubbling in the lab so that you can go think about something that isn't quite so memorization oriented. So I really enjoyed that part about it.
I know when I was in 9th grade, I knew I wanted to pursue a career that involved direct contact with people. And I knew that I wanted to study human physiology. And then I had to decide whether I wanted to pursue research or more clinical medicine. And I did some research looking at mouse models of multiple sclerosis and study anoxia and acidosis in turtle heart. And I said, this is not for me. It's more clinical research and clinical medicine. Just trying different things to see what path I should follow. And then I just said, if the door is open, I'm just going to keep pursuing it. And the doors kept opening. So I decided to pursue medicine and then become a pediatrician. But right now, my two other specialties of menstrual disorders and obesity medicine, those happen later, not after residency, which is when most people get their fellowships. So, and I feel like it's like a lifelong learner. We're all a lifelong learner, and I'm still going to take courses. And my next course or program is going to be on the science of learning and the science of teaching. So that's one thing I really like about medicine, that you can keep, with any other field too, but like especially in medicine, you can keep learning and keep getting more degrees if you want. It all started in 9th grade, at least for me.
I'll go next. Medicine was not, can you hear me? Yeah, okay. For me, it was not the very first profession that came into mind. I actually, I think it might be 9 years old. I thought I wanted to become rich and open my own bank and make more money, but then I grew up. So just like Shirley, I must have been, I was born and grew up in the Philippines. I think it was 15 years of age when I finally decided, no, it's medicine for me. No, it did not happen overnight. It's over years of exposure to difficulties in life around me. Actually, I think the top reason for going to medicine at that time was the scarcity of medical care in where I was growing up. I was born and grew up in a very small barrio in the Philippines, where if I wanted to see a physician, we would have to drive 30 minutes distance. And living in a small town, there's no traffic. So 30 minutes is quite a long distance for us. So scarcity of healthcare. And at that time when I was growing up, from age 9 through 15, I had many family members, relatives that have gotten very sick, and many have passed away. And for me to be exposed to diseases, illnesses, and death, and asking what had happened to them, in what ways I could have helped them. Again, seeing this around me, that sparked that passion of wanting to be able to help them and being able to provide care as well, which is there's such a scarcity in my surrounding. So that really what solidified my thought of going and pursuing that profession in medicine. So I left actually Philippines at the age of 15 and continued to have that desire to pursue this profession. Moved from the Philippines to San Diego, continued on and started to volunteer, inquiring how do I get, talking to counselors in high school and asking them, what do I need to do in order for me to go to a good college, to be able to go to medical school? I stayed in San Diego to go attend university, which is UCSD. If there's anyone of you from UCSD, that's my alma mater. And from there, did try research as well, volunteered in research laboratory, and even actually used that eventually as my work study. Volunteered in the hospitals, talked to people about medicine, whether they're MD, PhD, or PhD alone, or MDs as well, and did shadow physicians as well. It's interesting, my mom kept asking me back in college before I even applied to med school, are you sure you want to go to medical school? It's not going to be an easy path. It's not an easy career as well, or profession, being a physician. No, I would like to do this. She's trying to dissuade me to go to another path. So no, I want to pursue. I know it's not going to be easy, but I want to go to it. And eventually I did, I said, if I don't get in this next, first applying, then I'll try again. But I did. With God's grace, I did get in, and here I am. But yes, that was a long time ago, but I did decide to pursue a specialty in endocrinology, and have been at UCLA for 20 years.
So like Dorothy, I knew when I was younger, probably like around age 10, that I wanted to be a doctor. This is sort of like an idealistic view of, being a helper means being one of these professions. And I remember going to the doctor one day, diagnosing myself with the chicken pox, like around age 8. Because I had developed this itchy rash, and I looked it up in the encyclopedia and told the doctor, I think I have chicken pox. And he says, you're right, that's what it looks like. When I went to college, I entered in as pre-med, but very quickly realized how much the workload would be as a science major. And at that time, I started reconsidering that if this road was really the right one for me, especially if I wanted to have a family, et cetera, and other obligations. So after some thought, I actually decided to drop the science major and switch to music. To my father's chagrin, he wrote me a letter. He's like, this is very impractical. And, but I decided, I'm not very talented in music, but I'm going to study something I enjoy. And I'll take care of the 4 basic sciences, which that is required for med school, just in case after college I decided to go that direction. So did the bio, physics, chem, and OChem, and enjoyed the music major. After college, I volunteered in a clinic, and in the summers we volunteer at the hospital. And ultimately, after college, basically having to decide what I would do for work, realized that this was a profession I wanted to go into. But it was an easy decision. I think part of the challenge was I didn't know anybody in medicine, and really did not know what the road would entail. I knew the timeline, after college would be med school and residency, but what the lifestyle really would be. And so it was hard to picture. And because I couldn't really count the cost and really know the specific sacrifice that would be needed along the way, it was a difficult decision to make. But ultimately, I decided to go that direction, and many decisions go along that road in terms of what specialty you choose, et cetera. But that is kind of how I started.
Very good. Awesome. Love it. And I guess maybe we can do a little bit. So I think you've already touched a bit on, sources of inspiration that you've had for going into medicine. But maybe we can talk a little bit about, what's the best part and the worst part that is involved either in the day-to-day life or a little bit more big picture.
Well, maybe I'll start us off again. I think the best part for me has been it's just such a privilege, in my clinical work to. You really have a very privileged view of people's lives. There's an incredible trust that's there that patients put in you, and they may tell you things that they haven't told anybody else in their life. I think you get to accompany them through, especially if you have you're in a type of medicine where you follow people over time, and you become a student of humanity. I mean, it's really it's just a very enriching experience, and then built into it as well is that you are a teacher, not just to the patients and their families, but to junior colleagues, and that's something that you kind of grow in over time and becomes very important in your career, passing on your art to younger people. Those are some of the highlights for me. And the difficult things are, I would say, two categories that pop to mind. One is that it is a big commitment, even if you become a pathologist and have a 9-to-5 lifestyle, or you're in emergency medicine and you have shifts. That the training is pretty grueling. It can be anyway. It's a big commitment. There's many other ways to serve people and help people and be involved in patient care besides being a physician. So it's important to think, why a physician? Why this and not something else? And so that's one thing. And then the other thing is, it is more, can be more challenging to balance depending on what type of career you're going into within medicine. It can be challenging to balance the demands of your career with other things in your life. And so it requires you make good choices, honest choices, and many times it requires you have supportive people in your life to help you make everything work. So I guess that's what pops to my mind.
Esther, did you also want to jump in on that one?
Sure. Just to kind of echo that, I think the biggest sacrifice that you can see mostly in the forefront after college is the training. And I would say for the most part, it is a grueling experience to go through med school and then residency. There are some times of respite. Maybe you have the summer break or an easier rotation in between, but for that period of time, it's just kind of you're very focused on one thing, and there's a saying that you're trying to take a drink out of water from a fire hydrant because there's so much information that you are trying to absorb during that time, and that it is a stage, but oftentimes what's required of you is to be able to focus on that training and forego other things that during that time, like weddings, events, some maybe potential relationships, and putting some other things on hold. It is a stage so you can ultimately find time later after training, or even if you're very good at balance, it can be a little tricky, but it's important to have the balance in between all the while in terms of maintaining exercise and maintaining the most important relationships. But there definitely is, even in the midst of that, some things we have to put aside during that time. And I'd say, I think for a lot of us, our 20s, we're just very busy if that's the period of training for us. And I guess the question is the benefits that we have now in our career, if that is worth all the sacrifice. And I would say it's not an easy question for some of us in medicine to answer whether our career right now was worth all that training. I think for myself it was. It's not an easy career to have, but it definitely is, I agree, a privilege, and a privilege to be involved in people's lives in the way that we are, and also to have the training and knowledge and ability, the skills that we've developed over the years, and have the confidence from having that.
Well, okay, you all know I'm a pediatrician, so I love the opportunity to empower the families and to help the parents be the primary educators of their children. That's kind of overall. But I also like the diversity of what I do every day. So one day I might be rounding in the hospital seeing pediatric patients and newborns. Then I might come to the office and see patients who may have primary care visit, may have menstrual issues, may have issues with obesity. And I also have the opportunity to think outside the box and address the problem of pediatric obesity, creating a program that is family-based, behavior-based, and I meet once a month. And I do clinical research with it. I teach medical students through it, and I do clinical research, like I said. Then I also teach and mentor students and also high school students, which is one of my passions. I've also done administration work, and I like to write. And I get to be with children all day long. I mean, that's so much fun. And also the opportunity to continue, like I mentioned before, to keep learning all your life. The hard things are paperwork / charting your documentation. So that may take work, but if you organize yourself and create templates in the electronic medical record, that can make it easier. And we work together as a team with nurse practitioners and physician assistants, and they help me a lot. We help each other. But they help me a lot with the paperwork and things like that. And you learn to prioritize, and you learn to delegate, and you learn to multitask, because many times there'll be many people asking or demanding your attention at the same time. But I love what I do, and I wouldn't do anything else.
That's wonderful. I love it. So we're getting a lot of good practical questions in through the Q&A. So I think maybe we'll transition a little bit in terms of the how you do it portion. We'll throw it out there more as a general work-life balance, confronting the challenges. What has been like the biggest challenges that you have faced, or advice that you have for overcoming them? How do you maintain that kind of work-life balance and still give priority to your family while being a physician? So any of that we'll do a round, and then hopefully we'll be able to get into some of these more practical questions as well towards the end. But keep the Q&A coming. You guys are doing great. So work-life balance, how do you do it? How do you manage the challenges?
Well, I see everyone's slow to answer that one because it's not so easy. Some people question whether we should be using the term work-life balance, as if there was some wonderful Zen balance point that you come to and then everything's really nice and easy. I think things that have helped me are, first of all, to give up being a perfectionist. To get used to the fact that there's always going to be more work and more things on your to-do list than you can possibly do in one day. And just develop a sense of trust that it will get done, over time. Learning to prioritize, And then, as Esther was saying, learning to, care for yourself and rely on others and know your limits, your professional limits and your personal limits, so that you live within those And because you probably know this, but medicine is one of the professions where there's a lot of burnout. And that comes many times because people don't know themselves, they don't know their limits, they have unrealistic expectations of themselves or others. They are perfectionists. And those are all things that, we can grow out of. But it is, I think it's important to recognize that it does take a balanced person. I wouldn't say you have to have completely balanced life and work balance, but you have to be a balanced person in order to be able to thrive in a career in medicine, and especially if you also have a very vibrant life outside of medicine, which hopefully everybody has. I don't know if that's helpful, but I just wanted to cast a shadow of doubt on the term work-life balance, because I think it sometimes can set up an expectation that we're supposed to have this perfect balance that maybe isn't that easy to achieve. I'm sure some people achieve it, but I think most of us try, and trying is what matters.
How do I get through the day? I think it's as simple as trying to start your day on time. I mean, if you set that alarm at whatever time, it's best to really get out of the bed and not wait another minute or two to get out. Just set your day the right footing and go from there, and having an order of priority, just like what Jenny said, and trying to have a timetable, a schedule. And if work starts at 8, I mean, for me, seeing my first patient at 8 o'clock, if I'm in clinic, even if I'm in the hospital, I try to get there on time. If I said I'd be in the hospital on time, and even get there a few minutes before, especially nowadays where we have to sanitize everything, right? Anyway, but yes, really getting out of bed as you set that alarm, or even before the alarm has set off, to get out and be on time for everything. Yes, I agree. We may have put a schedule for the day to accomplish this and get this done, but there are times we won't be able to. But yes, working in the clinic, and you may see your last patient at 5 o'clock. We know we're not going to end at 5 o'clock and may not be able to get home at a certain time. But usually it doesn't happen every day. Thank God it doesn't happen every day that you're home late. But trying also to, yes, exercise is important, putting that in your life, because it's so good for our mental and physical well-being. Getting enough amount of sleep as well is important. Putting habits. It's not something that we can do every day. I mean, I like to bake and cook. So at the end of the week, I try to do that, and it helps me to relieve the stress that I've had for the week, and just to cook and bake for, not just for myself, but for everyone else, whether it's for family members, people at work, or friends as well. So having a schedule and putting order in your everyday life, and it's helpful. Prioritizing what's important to get that done, and focusing on that, not just the day-to-day, but the tasks that you have at hand. Keeping in that, getting easily distracted. So that's what helps me to get through my day.
And oh, good, Esther, you're the one I was going to call on next, so you have the floor.
Okay, great. Yeah, I would say that the two main stressors for me right now is being a parent of young children who I feel like need a lot of attention, not just to physically keep them alive, but even for our relationship. The children thrive on connection with their parents on a daily basis. And so for me, I do have, I think, a lot of moms who work, whether we're in medicine or not, deal with the mom guilt and wondering if we're doing enough for the children and if we're available enough to them. So honestly, for me, that issue is a tug of war. Some days I feel good, other days I feel extremely guilty. And I'm part-time. I work 6/10, so that's actually great that I have some flexibility. I work a shift schedule. So for me, that's actually just working 2.5 shifts per week on average, which is not bad. So I actually do get to see the children a lot. But like a lot of us who may be type A personalities, I have high standards for a lot of things. And I agree with Jenny that this whole journey is about, in terms of our personal growth, also being okay with not being able to do everything. The second stressor is, as I've talked to other physicians, is the kind of the litigious atmosphere that we work in, which is much more than it used to be even a couple decades ago. And especially if we're doing procedures or, doing a treatment, giving a patient a treatment plan that may end with different results. For example, for diagnosing, we do tests, we give someone a treatment. It's hard to predict how someone's outcome is going to be. And it can be, it may end up being an adverse outcome that really is out of our control, but that still could be a cause for litigation. And so I would say on a daily basis, when we're seeing patients, having conversations, documenting, that is always in the back of our minds, kind of the risk that is there. And that does affect kind of our experience of work. So I would say, this work-life balance, I think there is a better way. I'm not sure if I've heard of a better term to use, but it's more, I think, maintaining your mental health. And the way that, the thing that has been most helpful to me is trying to have a regular practice of centering yourself, either through prayer. Some people say daily affirmations or recall truths that they know about themselves and what they've learned about themselves. And I think everyone has a different practice, but some little moment during the day where they're able to remember kind of some wisdom that they've learned about life to recall. Because, in life, there are events that happen that can be very stressful. I would say I probably go through that once every couple months, where I had a patient that was very, very sick and it was stressful to take care of them. It does take a few days for me to process it. And, talking to other colleagues, we have people in our department who are designated to be the person to talk to, just to be as a peer. So reaching out, taking time to check in with yourself and determining what your priorities are, that really, and you're doing that consistently along the way, that is very helpful, because since we are all making decisions about where our career is going to go, what responsibilities we're going to take, we'll need to do that, because we'll have to say no to certain things, leadership opportunities, or, more work in this particular area. And it can be very interesting to you, but at the same time, it's going back to, well, do I have the time with all my priorities? Is this a good thing overall for my mental health, kind of thing? So that's kind of what I've learned over the years.
That's great. And Esther, there's a question related to shifts. So you mentioned you have these shifts. That's largely a function of being an ER doc. Is that right? Are there other specialties that would permit for that kind of schedule?
Yeah, there are a lot of fields that actually work in shifts, mainly in the hospital. So if you're a hospitalist, if you're an internal medicine doctor that works in the hospital, or a lot of specialists that take call in the hospital, they are taking, the call tends to be like 24 hours or roughly, more or less. And those can be shifts as well. So I think when you go into your training, you'll actually, even within a certain field, you'll be able to either work in the clinic and have more daytime hours, or if you're working in the hospital, you could do more shift work too. So there's a lot of options.
Wonderful. And also, since I have you, a lot of people are wondering about the DO. So maybe now could be a good moment as well to comment a little bit on that.
So DO is for Doctor of Osteopathy, and I don't know what year it was created, the school, but the schools of osteopathy, they will teach this extra course in manipulation, which is where the chiropractic practice came out of. And there are some DOs that do manipulation in their work, but very few of them. They tend to be primary care doctors. And most people who are DOs that go into other fields, we don't have time to do that. So in my experience, the DOs tend to work alongside MDs and do the same work. So.
Very good. And kind of like what, was there a main reason why you would want to take that path? You would want to take DO over MD?
At that time when I applied, I was very close to a DO school, and I was living with my mom. I had gone to school in Claremont, and there's a DO school in Pomona, so very next door. And I was dating my current husband, who was working at UCLA, so it worked out well that I was there. And but I think whatever path you go, you can, as long as you are working hard and you're able to put in the time, you can really end up being in whatever field that you have interest in.
Very good. Awesome. All right, so maybe we can transition a little bit, talking briefly about research. So for those of you who do research, your path to that, of course, MD, PhD comes up a lot in this context. What does that look like in terms of doing clinical research versus basic science research, and factors related to that and applying to medical school? These are some of the things that the audience is wondering.
Well, I don't have an MD, PhD. I have something called an MD, MPH, Masters in Public Health, because my field is epidemiology. So basically studying large numbers of people and trying to find, make inferences based on big data analysis. So within research, there are many different types. And so my interest is more on the clinical side. And in addition to that, I do something called implementation science, which is more a brand new field, studying the implementation of new models of care or new methods of improving healthcare quality. And you can get a PhD in that. So those are some of the newer kids on the block in terms of research degrees. And maybe someone who has who's done more basic science research can talk about that pathway, which I usually associate with MD, PhD.
I guess, I would just say I'm still pretty early in my career, but I really like it because it gives me the opportunity, I think, as I said earlier, to sort of explore basic science a little bit more. You can do the MD, PhD in a more clinical route, or you can do a more basic science route. My understanding is a lot of residencies actually prefer that you have a basic science. If you're going to do the MD, PhD, you do it in a basic science. That might not be true universally, but that was some advice that I was given. That's kind of where the advantage lies if you're going to take the time to do the PhD. But for me, I really enjoy it because I like both. As I think I answered to someone, to me, the MD, PhD, they're kind of like two sides of the same coin. So I really enjoy working with people, but then research is, as one of my professors once put it, sort of the lifeblood of a medical school. It's what advances science, is what gives us the chance to, there are a lot of things we still can't fix right now. And so it kind of gives hope to medicine in some ways, because that just where we are isn't where we're going to be in the future. We still have a chance to work on those areas where we still need improvement. So.
I guess I would also add that it's gotten more challenging in recent years to have a research career and a clinical career, because you have to pay for yourself one way or the other. You either have to bring in a lot of money from grants, to get funding to pay for your work, but it's also paying for your salary. And then if you're an MD, you're expected to bring in money from clinical care. And so, so anyway, the research path is a wonderful path. It's a very flexible path in many ways, but it does require a lot of hard work and talent and ideas, because it's very hard to get the money. It's more competitive now than ever before. That not to discourage you, but you have to be pretty focused and determined. And if what you really like is the research side, and not so much the idea of medicine and medical school and practice, then you're probably better off doing a straight PhD. So it is a wonderful combination for the right person, but it's a lot of hard work to really make it in research, and you have to be a risk taker to some degree. You have to be willing to never give up and just keep trying and trying and trying to get those grants. So I would say it's a lot less predictable and stable than a career as a clinician. But for those of us who love research, it's really worth the effort. It's worth it. But you can try it out in different ways before you commit yourself to that, a PhD or an MD PhD or some other research degree, to see if you have the research bug, because you kind of need that in order to, to really make it a go.
I would follow up on that really quickly, actually, and agree with everything Jenny just said, but also I received a lot of advice because I wasn't sure. I went back and forth a lot about whether to do the MD PhD or not. And I spoke to a lot of people. I was too lazy to actually do this myself, but a lot of people have gone through and crunched the numbers. And so if you're looking at it as a free ride to medical school, it's really not worth it, because you'll make more money if you just get your MD and get out. So don't do it for the free ride. And the other thing is it is a lot of time. So if you don't really think you want to use the PhD, it's really not worth the time, I don't think, for the letters after your name. I mean, I really love teaching and I really love research, so I think I will ultimately use it, which is why I decided it was worth it for me. But yeah, don't do it just for the free ride.
Great. Another big theme that I'm seeing in the questions is related to choosing your specialty. So maybe you might want to pitch in a little bit of what advice you have for people that are trying to choose a specialty. I know this can evolve a lot over time, but advice that you have for approaching this, or if people are kind of inclined to one specialty over another, what practical things would you advise them?
I love working with children too, but my first rotation as a med student was in pediatrics. The very first day I got sick. I said, I don't think I can be a pediatrician. And I could not look at my patient's ears. And it's like, I don't know how Shirley does it. I ended up just playing with the kids. But anyway, so I said, I like being with you guys, but I don't think I can be a good pediatrician if I can't be a good doctor. I enjoy going through medical school. I really enjoyed working with patients and looking after them with chronic illnesses. And I like the ambulatory setting a lot. So as an endocrinologist now, this afternoon I was just talking to my last patient, and she was telling me about the family. I asked her, how are the kids doing? The first one is 18 years old. I said, I have known you for 18 years now? I told her, yes. He said, because I had met her when she was pregnant with her first baby. So it's just the beauty of being part of their family. If you like, which I enjoyed, taking care of patients with chronic illnesses. Yeah, majority of patients, we're not going to be able to cure them, but at least stabilize their health, their illness. And being part of their life and getting to know not just them, but every single part of their family. So that's how I became an internal medicine physician. And I ended up pursuing a subspecialty in it, which is endocrinology. It wasn't easy. It's actually between oncology and endocrinology when I was a resident. I also enjoyed working with patients with cancer and going through the detective work and finding a way to treat their illnesses. But I'm glad I'm an endocrinologist because I'm also an oncologist for patients with thyroid cancer. So I think I made the right decision. I'm both an oncologist and an endocrinologist at the same time. Why not surgery? I was in my rotation in surgery, assisting a pneumonectomy. We're moving along. I almost passed out as the surgeon was trying to dissect the muscle. I said, "That's it. It's not surgery for me." So it wasn't a very hard decision to go into internal medicine for me as a fourth-year medical student.
I would say sometimes you may not be able to determine what field you want to be in until you experience it. Because I'd have to agree. I never would have thought I would have chosen ER. And actually, I initially chose after residency physical medicine and rehab, which is the exact opposite end of the spectrum. I knew I liked a little bit of everything. I liked knowing a little bit of every specialty. I liked anatomy and orthopedics. But I was scared of like the acute injury and disease, and I didn't have the confidence I'd be able to take care of patients in that setting. So I actually started my residency in PM&R after doing my internship in internal medicine, and was bored to death once I got there. And my husband was like, "Oh, I should have just told you no," you know. So I ended up having to go through the rematch, and by then I had done already a few rotations in the ER and realized that's the place for me. Again, it's a little bit of everything, but by that time I had gained some confidence and realized, oh, that's actually the area I like to be, kind of assessing someone and, you know, sometimes diagnosing and stabilizing them. So, you know, sometimes you might be surprised with where you are at, and as you grow and learn and develop, what you'd be interested in at that point. But knowing the schedules and like surgery versus other, that definitely helps too at the very beginning.
So I was between pediatrics and surgery because I wanted to have a sense that somehow my patients were going to get better, which is true for both of them. But if I went into surgery, I wouldn't have had the long-term relationship with my patients for the most part, and then long-term follow-up of them that you see in primary care. And then within pediatrics, I struggle between becoming an endocrinologist or staying in primary care. And then by doing obesity medicine, I'm kind of involved in the field of endocrinology in the terms of prevention, trying to prevent type 2 diabetes with my patients. And I also took into consideration the population I was going to be serving, like the kids and the families. Some people don't like that, some people like that. And my coworkers. And that's something you get a taste of when you're doing your rotations.
Awesome. So maybe I'll throw out one question before we do just general advice, last words. But there's a lot of interest in understanding who you would advise not to go into medicine. And maybe a more positive way to put it is, what would be your litmus test for seeing if someone should really go into medicine, if they can really thrive in medicine? What would be in your litmus test, or you know, what would be like key predictors or key things that you want to avoid medicine if XYZ?
I have one sentence that might help you decide. So if you like to work with people and for people, if you like to study human physiology, and if you like the idea of being a lifelong learner, do you like to own the responsibility of making scientifically based medical decisions related to the care of your patients, i.e., deciding what test to order and what treatment to give your patients, and think about medicine?
Well, I would say definitely don't do it for the money. It's not worth it. You know, it's, I think to thrive in medicine, you have to love what you're doing. And I think you have to be someone who's not afraid to work hard and has the capacity to work hard. And you don't have to be a genius, but you do have to be dedicated, focused, and And I would say have the ability to care for yourself, you know, to be mature enough to care for yourself, as well as care for your patients or whatever it is you do within medicine, which is a very versatile career. And we haven't even touched on so many of the different ways that you can live out your career in medicine.
Let your motivation be service, spirit of service, and love. You know, whatever career you end up doing, whether it's medicine, but definitely medicine. Being a physician is truly a service to others. So having that spirit of service, motivated by love and for love, and yes, and humble enough to know that we cannot know everything. So keep on studying, and if you really have that in your mind, that every day, and medicines, the technology is going, everything is going by so fast, and everything is changing each day, things being published. So try to keep up with, like I think it was Shirley and Jenny said, a lifelong study.
I don't have much to add on that, since I don't have, I guess one thing I would say is I did attend a pre-medical conference once, and one of the speakers made a really great point. He said, basically kind of made the point that you can fake things externally, right? But at the end of the day, there's something sort of within you. Do you really have what it takes? Is this going to make you happy or not? And really at the end of the day, only you are going to be able to tell that. So not really sure what litmus test exactly to go with for that. But if helping other people, if doing these sort of medical things is what energizes you, I mean, sure, they're going to be exhausting days, but if that is really what makes you really happy, then that's a really good sign. If, every time you sort of interact with people, if you just find it exhausting and draining, then that's not quite such a good sign. So, but at the end of the day, really what it comes down to is you're kind of going to be the only person who's going to know, because you can fake a lot of things on an application. You can look really good and you might get into it and realize you hate it. So just be sure it's really what you want to do.
Wonderful. Okay, so in our last minute, open floor, any parting words, advice you want to give to our audience listening? I think we definitely need a part 2. There's so much that we could talk about here, and you guys are phenomenal panelists, but any parting words for now you want to leave our audience with?
I would just encourage, anyone who's interested in the field of medicine, it's so important to have the opportunity to try it out and at least get some exposure to what it's like. And that's how you figure out if you have that fire inside. So I took 2 years in between college and medical school. And I worked as a research assistant. So I got to see, over those 2 years, what it was like. I worked closely with physicians, and that really helped. So it's good to not just be dreamy about it, but see if you can really get exposure to it before going in. And during that time, as you're checking it out, you may discover a lot of things about yourself that either make you more or less inclined towards medicine.
Another way to expose yourself, I would say, in the hospital setting is some hospitals will have scribes, and I've had a couple colleagues who had opportunities to work as scribes and learn the medical terminology and actually be the person next to the doctor in patient interactions, and getting to see how things go, and also seeing other occupations in the same field that could be an option as well. So I agree. I think getting yourself into that setting, getting to speak to other physicians, and getting experiences would be really helpful.
I would just agree. I think if you can actually do something like hands-on where you feel like you're more involved, that's a much better place to be than just to shadow. When I shadowed, I didn't find it all that interesting. I was like, oh, this isn't really interesting to me, but I wanted to go to vet school because I got to work with the animals and I got to think about things and do a lot of different hands-on kinds of experiences. So I think if the more hands-on experience, the more you can kind of really feel what it might be like, the better idea you're going to have about whether it's right for you or not.
For those who want to read more about this, there is a book called Official Guide to Medical School Admissions that I found very, very helpful. Every 2 or 3 years, a new edition. And also, we have a monthly meeting called Medical Interest Group. If you want to learn more about that process that we use in medicine or learn more about medicine, just send me an email and I'll give you some information about it.
Awesome. Well, thank you guys again, panelists. Big thank you to taking the time for this and all of the words of wisdom you just imparted. And to our attendees, thanks for coming and hopefully see you next time. All right, take care, everyone.